I am not aware of any state that allows families to purchase buds to use as medical cannabis. However, there may be some situations where it is the best way of using it, and therefore you'd think maybe for kids as well. Now, should the states be reconsidering the way that they implement their medical cannabis program? Let's talk about it. Hey everybody, it's Dr. David. Hope you're having a wonderful day. For those who don't know, I am a board certified pediatrician. I am also a very experienced physician when it comes to certifying people for medical cannabis. And from what I understand, I have certified more children, more minors, than anyone in the state of Florida. Of course, there are specific medical reasons why we do this, not something that we take lightly, but there are a lot of medical conditions that we have seen significant improvement with the judicious use of medical cannabis. Now, I know of no state that allows for buds, for flower, to be given to kids. Okay, I'm assuming that's because the lawmakers who don't have any knowledge of, very few who have any knowledge about the medicinal aspects, think that that means that if they're given buds that they're going to smoke it, and that's not what we're talking about here. To be clear, okay, and I'm absolutely not advocating that families get marijuana to use illegally for their children for these medical purposes. So just to be clear about that, a lot of this is actually going to be talking in some hypotheticals here, not hypotheticals into the health aspects, but hypotheticals in terms of the what may or may not happen, because I realize that these state laws, of course, need to be followed. So we're going to be talking today about why I've seen medical cannabis as a whole and how to help with children, and the different ways that cannabis can be given, but also why I think that the buds, also people known as flower, might be the best thing under circumstances for children. Okay, now in terms of what I've seen for kids, so I have seen remarkable improvements in things like seizure control. I've seen people completely stop having seizures whatsoever, and off of their seizure medications by using medical cannabis, mostly in the form of CBD for that. Behaviors, especially for kids with autism, especially as they're hitting puberty, the violence, the aggressive behaviors, the irritability, which can certainly happen in younger kids as well. Oh goodness, it can just really do a wonderful job at taking care of that. Panic and anxiety. A lot of kids have anxiety. We know that there is a big uptick in this, especially since COVID. This can be a very effective treatment. And again, I'm not talking specifically about buds right now. I'm talking about different forms of medical cannabis and what I've seen. Cancer pain. I have patients, unfortunately, we know kids get cancer too, and their ability to have better appetite because of the appetite stimulating properties of cannabis, as well as the pain, chemo, and there can be surgeries and all other kind of things that can be involved where people have long-term chemo pain or radiation pain, and that can be really helpful as well. And I have certainly seen teenagers with Crohn's disease have a significant improvement in the inflammation of their bowels, and some even to the point where they don't need to take the other kind of biologicals and medicines that are used typically for inflammatory bowel disease. Okay, so first of all, in this hypothetical talk we're having here, but this is true not just for buds. This is true for all forms of cannabis and the medical cannabis program. The reason, and possibly the most important thing about the medical programs in the states, besides the fact that it makes it legal in the first place, is that states can control the accuracy of the products to make sure that the number of milligrams or percentages of THC are accurate, but also to make sure things like pesticides and heavy metals and molds, mycotoxins, that they're not present in there, because that could be potentially really harmful for people. And so, when people get things on the street or from a less regulated sources, people could be putting all kinds of stuff into their body. In addition to when they get a particular product from medical cannabis dispensaries, of course, they're getting the same product every time. When people get products off of the street, they are very unlikely to get the exact same product every single time. And that can be problematic. It's like if you were a person with anxiety and you walked into the pharmacy and they said, "Hey, we're out of Prozac today. Would you like some Paxil?" And of course, besides being highly illegal, and you'd probably laugh and report that pharmacist to the board, of course, that's not okay. You need to have the same product all the time that's working for you. Okay. Now, in terms of some of the other forms, before we get into the buds, of course, there are tinctures that are available. They can be put under the tongue or just swallowed. It is one of the best ways if you need to do very low dosing of THC, especially. But overall, for kids, liquid forms. are often easier ways of getting things because some may not swallow capsules, etc. Now, capsules can be precise, but usually, especially when it comes to THC, they're high potency. Rarely that you'll find a 5 milligram capsule, more often 10, sometimes even more than that. And that is way too much cannabis, at least to start off with for a kid. In fact, I'd even say for most people, but especially for kids and for smaller people. Okay. Now, of course, there can be sublingual tablets. They also typically, at least here in Florida, come in 2.5 milligrams. That's a good starting dose for somebody, 2 to 2.5 milligrams if they're trying out THC for the first time. Now, it may be, of course, hard for some kids to keep it under their tongue, though. And if it's not held under the tongue, it's no longer sublingual, right? And of course, just because of age or functional level of a kid with autism, for instance, just may not keep it there. But there is also something that people can chew, that a kid can chew, and it'll still get in like a other kind of edible will be or a tincture. It just won't have as fast of an action, and it's not being absorbed into the body the same way. Of course, there are edibles, and it can be precise. You can also cut some of the products into half, in quarters, eighths, especially in terms of gummies. Those are really easy to cut. And of course, with the added advantage of a gummy or other edible is that kids are more likely to consume it, which of course why they need to be stored in a very safe and secure place. Because even though it's medical cannabis, it's still, if a kid got a hold of a jar of THC gummies, we may have some interesting times on our hand. And of course, there are patches, which are often a slow release of the cannabis over a period of time. There are topical sports gels that can be used for more muscle pains. Some people will find that it does help more systemically throughout the body, but that's a little bit more open of a question. Now, okay, so now that we've talked about those other forms, let's talk a little bit about why I think that the original plant-based form may sometimes be best. Okay, so first of all, some people feel, hey, I just want to use the plant. That's the natural way to go, right? That's what came out of the earth. That's the way I want to use it, or that's the way I want to give it to my child. Okay, again, this is theoretical. Now, it is also too important, and the reason why I think that this is super important is because a plant does not contain 9-delta THC, which is the part that gets a person intoxicated. It has THCA. THCA is a pre-THC. It itself does not have any intoxicating properties, but it has wonderful anti-inflammatory properties and other things. So people can use it. I know people use it for juicing. That's a way of getting it, because you can't really just eat the raw buds. It's pretty nasty. But people do juicing, and they're able to extract it that way without heating it up, because it's the processes that heat it up. That's what cause the high part, that turning to THC. There is also something called THC diamonds, which is pretty amazing that they figured this out. So THCA, A stands for acid. Okay, and what they do is they can take the flower and they can soak it and then rinse in a high alkaline type of water. Then what they do is they then rinse it the same way, but the alkaline of the which is a base of the water combined with the acid of the THCA causes the THCA to crystallize. They call it diamonds that are created, and they precipitate out. They settle on the bottom of that aqueous solution, which can then be captured. And in and of itself, THCA again is not intoxicating. So these would be great products to have available for some people without getting them high, right? Some of the dispensaries, you will see THCA available in a crystal form or in a powdered form, but it's been hard to find them recently. And I don't know if there was some type of state crackdown on that. I'm not quite sure, because you would think even if it's sold under THC, it would still be able to be obtainable. So I'm not sure why that is. And that may not be in other states as well, but at least as here. Now, you could also take those diamonds that are collected and turn them into edibles, right? Now, of course, if you bake a good, that wouldn't work. But you could put it into like a gummy that doesn't require, that's more at room temperature, and when you're making it, and then it stays in the THCA form. Okay, but of course, if you do heat it, that's what your 9-delta THC is. So when you hear people talk about THC, 9-delta THC is what they're talking about. You will hear about 9-delta at like smoke shops that are using that are making these products out of THCA or 9-delta THC. I wouldn't trust them as far as I could throw them, however. But as far as the health benefits, so it has been hard to research THCA for the same reason why it's been difficult in America to research THC, because of the Controlled Substance Act and the fact that it is a Scheduled 1 drug, which of course we've talked about means that supposedly has no medical benefit. Now that THC is being moved into a Schedule 3, I do anticipate that will be a lot more research, not just on 9-delta THC, but on THC-A, as well as other THC cannabinoids as well. But most of the research has been done in animals, but it has been shown to have to have relief for pain relief and for nausea, but also anti-inflammatory. So pain, whether it's or Crohn's disease, most chronic disease has an aspect of inflammation. So anything that we can do to lower inflammation while not suppressing the immune system can be very helpful. Also, THCA has been found in animal studies to have anti-seizure effects. It can be neuroprotective. Seems to lower the protein that's been linked to Alzheimer's disease. And maybe increasing those people's, it's not just taking down the protein that causes the problem, but improving their cognitive function. And it has been shown in some studies to also improve metabolic syndrome, helping with weight loss as well. So I think that there's a lot of benefits overall. Now, of course, some of those things aren't kid related, of course, like Alzheimer's or the need to, to lose weight. Well, I guess that could be an issue for some kids as well. Now, so how would the kids ingest them? Okay, so again, to be clear, I'm saying it again, I'm not advocating that people go out and get this illegally. I'm talking again in hypotheticals if there were to be changes in the state law. But I do think that, again, this is just for me to discuss what I think could be best based upon available. Now, in addition to having buds available for that purpose, okay, and again, advocating for nobody to smoke. I don't recommend anybody smoke anything. Okay, but there is a concept called dry herb vaporization. Now, kids are allowed to, at least in the state of Florida, to get vape pens, to get vape oils. They're allowed to dab, which, that could bring very, very high potency THC to the body. And you may not want that much high potency. They could be 70, 80, 90% THCs. And a lot of parents are like, I don't want to put that much. I want to use a much smaller amount. The buds themselves are a smaller amount, anywhere from 15 to 30% THC. Dry herb vaporizing is a way where you can take the medical marijuana and you grind it up, similar to if a person were to roll it up into a joint. But instead of doing that, it's put into a device that has an oven. Like it's a bowl that has like an oven around it, and it heats the temperature up to a point where the active ingredients, not just the THC, the other minor cannabinoids, the terpenes as well, are released into the air, but the plant doesn't burn. So if a person's wanting to avoid their kid or anybody else smoking it, it goes in green, it comes out brownish bronze, like broiled in a way, but there's no burning. So it is a much safer way. So if a kid is able to get benefit from inhaling it, and they're allowed to be using a vape pen or something like that, shouldn't this be available too? I think it's safer. Of course, fortunately, with vape pens, if to me it's an illegal vape pen, then it wouldn't have the vitamin E acetate, which was causing the burning out of the lungs in people when there were all the vape lung injuries that were happening. We found out that it wasn't due to THC, it wasn't due to cannabis oil, it was the vitamin E acetate that people used to swallow as part of their supplement, but nobody was ever intelligent enough to actually breathe it in, and that's where the problems were. So that's also why I think that could be a helpful way. And again, if other forms of inhaling it that's more potent is allowed, why shouldn't something that's safer and less potent be allowed? Okay, so, and of course, one of the advantages of the inhaling of any form, but including this, is the instant benefit. So if a person is having a significant painful moment, that can be turned off in 5 minutes. If a kid with autism, for instance, is having a major meltdown, that could turn things around really, really quickly. Okay. For that matter, if you're having, again, having a seizure, a person, if they're able to inhale, could be able to break this up. And, that's also where to say that, there are inhaled versions, at least in Florida, that is like an asthma puffer that works with a spacer and with a mask. And if it can cover the nose and the mouth, and they're still breathing, they'll get it in. And that could be a way to also break seizures. Obviously, there's other medicines out there as well. Okay, so again, in terms of my concerns, number one and foremost, I don't want anybody smoking anything. And again, please remember, this is a hypothetical situation. I'm not advocating people getting it legally. But also, let's face it, there are kids who are getting flour off of the street. And who knows what's in that? They can, teenagers often get it. Obviously before there was any medical legal, let's face it, that's how everybody got it. But issues with pesticides, heavy metals, not getting the same product every time, those are all issues with people getting on the street, and why for sure nobody should be getting cannabis on the street. All right. Well, that's something a little bit different, but of course, still keeping in mind with the things I like to teach about. Your health, your choice, of course. And of course, if you like this, please subscribe. If you're not a subscriber already, join us on Patreon, where you can help support the channel and share this information with others. Have a nice day.